Chief, you're welcome back.
Thank you very much.
Hello, sir.
Yes, I'm online.
All right. So paint the picture for us. What's the state of affairs when it comes to the national health insurance with these private operators?
Yes, the current situation we have at hand is that the authority is unable to make the application to a private hospital, clinic, and maternity homes across as we are speaking. Assembly said,
Mr. Toblu, the line is, if you could raise your voice for me, I hardly can hear you. It looks like where he is, the reception is really, really bad. Really, really bad.
Yeah, can you hear me now?
Come again?
Can you hear me now?
Yes, I can hear you.
Okay, so can we go?
Yes, you can. So I was asking the situation at the moment.
Yes, I am saying that as we speak now, the National Health Insurance Authority is unable to meet its indebtedness to the private health facilities across the country, just because they have not gotten the needed funding from the states, that is the government. And then a problem because in the past months, anytime we are in HISCA and we go to the National Health Insurance Authority, in some cases they were able to give us promise and fulfill such promises. But for some times now, it has become very difficult for them to meet their promises. And our own investigation, XRSA, they don't even have the money in their offices, otherwise they would have paid. And we did further investigation. Who said the government is unable to release money to the National Health Insurance Authority for onwards payment to our facilities. And no problems here. And here, we are speaking squarely to the door of Ministry of Finance.
Opani, how many months of indebtedness in Yekan
we have 7 months claims outstanding. 7 months claim outstanding. We also have spotted claims of some other individuals for the period more than 7 months, some in 10 months. But on average, we are talking up to 7-month claims in arrears.
On a normal day, what's the arrangement like? Say, clients of the hospital and also patients at the hospital, na omukuta card, na momo service ni we, na momo draw all on the back of National Health Insurance. Now, reimbursements, when is it to take effect?
Pacho, if you go deep into the law, within 1 month, I say, I buy a car. But young Kasa, who say, 1 month, because of the volumes of claims that they have to process, any new marketing, to me, meet is our deadline. And say, by convention, and some form of arrangement between any National Health Insurance Authority. We agree, sir, at least within 3 months, on better car. But 3 months, and edani 6-7 months, SMCCA. So, under normal circumstances, it should be monthly. At the end of every month, they are when you submit will keep it there. They have to pay you. And the normal standard. Now you can reference this in the LI 1809 section 37 to 38. In the LI, that is the standard.
But 7 months indebtedness is more quantifying in financial terms. That's about the Mokahi.
Say you quantify a day. Because Mami analysis be true, no idea. it is not about the quantum. It about provider needs.
Okay.
Because obi wa ni claims here 20,000 for the month.
Mm-hmm.
And it's at 20,000. If you multiply it by the number of months, one Giannicano, 140,000 Ghana cedis. And a being sure almost claims per month, 200,000. A being 300,000 per month. And if you multiply 300 by the 7, you are getting 2.1 million Ghana cedis.
Okay.
Also, what you say?
Yeah.
And it depends on peculiarity of the nature per provider. Because a particular provider, 20,000 is sufficient enough for him or her to manage its facilities. And at the same time, that same amount is insufficient for another facility to manage its facility. So we are talking about peculiarity here. But so we are not much concerned about the quantum. We are much concerned about monthly reimbursement. And no a problem no. Monthly reimbursement. Now, would the car bear 6 months, 7 months? And it's a wood to me 6 months. No, we are why you say okay. See them medical 6 months. Now the people continue to do business with that. And the idea is said, fiti ene econo every month biano mema omusika ya dream paper form. I dream paper form bre ubia benya ahuto. But if it doesn't come, anu na ye problem no.
Okay, so then how do you stay afloat since suppliers of these drugs, really may not care, say, what supply on onwardly, or the amount of patients now emergency also tiauka. How do you operate these facilities?
Best question. This is your best question, Papa. How do you float? How do you float? Now, come to talk about floating. Sisi Ameka say, we have chamber of pharmacy. Any pharmaceutical companies are almost supply a draw. But for some times now, Yantumi and Chiomukano, they have also withdrawn the credit facilities. And also, as some Kesiabia, we have what you call medical consumables. Medical consumables are your car gloves, cannula, syringes, cotton wool, and in your marketing kitty, yedi yejumano, yedi nina kanwa. That is what we call medical consumables. We have what you call statutory bills payment, PAYE, SNIT contribution, some other fees and registrations that we pay to regulatory bodies. Nina Boma, we are in a big trouble because the monies are not coming. Again, about 95% of revenue facility they are generating is coming from the National Health Insurance Authority. So, if National Health Insurance Authority and to me and to in a month, Nipan sa facility no obenya 5% revenue. Sa 5% revenue no to me financial. What you say? And the floating has become a major challenge. Major challenge. And I like the question you have. How do you float? Now, say to me a float here, it affects the generality of patients that visit our facilities. Are we talking about quality healthcare delivery services in this country? If the answer is yes, what makes quality service delivery? Before the inception of National Health Insurance, it's premised on 3 good things: affordability, accessibility, and cost. Are you getting it?
Yeah.
So if we have accessibility, fantastic. Affordability, fantastic. And then the people who are providing the services are not being paid, then these 2 things cannot work. They cannot work.
Now, Bacho, your pharmaceutical suppliers, now we can say, they've stopped supplying you. How long ago no more stop here?
And our payments to them has not been very good at all. We have not been paying them well. There is a proverb that if you cry for the chicken, you cry for the hawk. if we are unable to pay them properly, mind you, dollar is rising every blessed day. Dollar is on the rise, and most of the drugs are omudiba, they bring it from outside, and the prices of the products continue to rise every now and then. The question is, how realistic our pricing at the hospitals are vis-a-vis the price list of NHIA, which has not been reviewed over a relatively long period of time. And when in the private health facility providers, they are in a serious problem. And I want to say this on authority, that we in the private sector, we have no moral right to blame National Health Insurance Authority based on the relationship they have had with us in terms of payment. But we have come to realize, in all certain and clear terms, say the government release of funds to NHIA has been very, very, very porous, and that is what is affecting us. So when two elephants fight, the grass suffers, and we have now become the grass suffering because of the government's inability to release money to the National Health Insurance Authority. And then there is a problem. And she said, the people who accept go to the hospitals, clinics, and the maternity homes in the country eventually will become victims of circumstance. Victims of circumstance.
Apani, maybe say a question, but what you mean? Maybe say, for how long have the pharmaceuticals supplies not stopped to more outfits now? Hello?
For the past 3 months. You see, this is on individual basis. It is not holistic. It is on individual basis.
So
who call hospital A, they tell you we can't give you anymore because your payment system has been porous. And I will call hospital B, because they have other means of generating revenue.
Okay.
To me, I'm a scabby, and they will supply them in a smaller quantity whilst are waiting for a bigger check to enable them, give them a bigger supply. So it is based on facility by facility.
All right. So
And
the facilities,
it is not holistic.
the facilities which don't have the capacity to internally generate revenue, would I be right to say, sir, for the 3 months, have been charging customers, clients, patients, our more urban for these drugs that are supposed to be free?
Let me give you, go to the public facilities. All right. This one, I'm just giving you an assignment. Go to the public facilities across the country or just in Accra.
Okay.
Begin to assess healthcare facility and see whether or not you are going to pay money for the services they render to you or not. Just do that on your own. I am just giving you open statement. Experiment it and see the reality of the situations on the ground. Go to the public facilities. So if public facilities are taking money to enable them float, how much more private man who has to pay electricity on his own, pay PAYE on his own, pay all other utilities, but the state facilities that their salaries are paid and they are given all the necessary apparatus to work, and yet they have to charge some amount of money to enable them survive. So if you put these two institutions together, you could see that the private man is an angel for the patient.
All right. Mr. Toblu, hold on a second for me. Now, there are one or two other questions I want to ask you and to us with the conversation. So hold on for me. Yentwaso na yendi enkomo Mr. Toblu ewa homanese no endi enkomo. Mr. Toblu, so I was asking, and you made the point to say you can state emphatically said the public health facilities are doing cash and carry already.
I am just telling you that go to any of the public health facilities. Begin the process to assess healthcare delivery to determine whether or not you even pay a CD or not. Okay? If that doesn't work, then you can come back to me. But I am telling you on authority that begin the process to go to any of the public health facilities in the country. Be it 37, be it Kolebu, be it police hospital, be it any of the district hospital. Just initiate the process and you will see the outcome. And when you see the outcome, come to the public and announce what you have seen.
Even
and
before
that will tell you the side of the private man and how the private man is suffering.
Even before Meko any of these institutions are Makono, I am convinced to say you have some knowledge as to the practice today. What do you know?
Masamni said, what I do know is that those institutions are almost to me generating some small monies. There are drugs that are not on the health insurance list, and you can generate revenue from there. Apart from that, as a private man, you have no other option than to give drugs on free basis to Obia or the health insurance card about your facility. That is the practice. Aside that, all I am saying is go to any of the public facilities to ascertain, say, then
but in the private sector, members know Mujisika for even drugs that are on the national health insurance. Seeing that the indebtedness of government to you is over 7 months. The people who supply you these drugs are now fancy be a letters of credit here available in you have some space to utilize and then pay later on any hobby and to more charging more customers for drugs that are supposed to be free.
I feel we are now thinking, sir, we have to go back to the National Health Insurance Authority. So other services need there. But a drone one there, a higher dream because we do not have control over the drugs. Because a drone, you talk a drone free pharmaceutical companies, and yes, we are the drone patients without getting money to procure another stock. A hard dream. And in a hospital environment in Isono, you need what you call essential drugs at all times in your facility. To the extent, say, Nyamimpegu say, Obi collapses, facility say, you have to resuscitate Sanipana. And I would need essential drugs. I would be yes, Ajumana. Oben who say, a sickness or a condition that the person shouldn't die out of. And Nipani Edibebu. And see, our hands are very tight to the extent that we need the necessary implements to work, but the conditions and the prevailing conditions are not allowing us to operate as expected. Okay, maybe we were talking about universal health coverage.
Yeah.
Okay, is a language. Yeah. Universal health coverage. Before Ubenya universal health coverage, yes, sir. All facilities should be up and doing. People who visit such facilities, they will have to get exactly what they are looking for in every corner of the country. So in our case, universal in Ghana, then we are good to go. Then the world at large, then we are making progress. But you see, I can say, universal health coverage, we are not there at all. We are not there simply because the content of achieving universal health coverage, some are not functioning as expected, and the end to mean draw.
All right, but earlier, now all KBB fast spotted claims is a material. Now work as and know some of your members know over 10 months. I don't know claims no.
The same claims are submitted to the Health Insurance Authority. For example, will be a submitting a June claim.
Okay.
Start June claim no omantua, and say the next time they want to pay Sanipana omantua be instead of paying the June claims, they are going to pay August claims.
Okay.
And this claims is still hanging. And then the fresh spotted claims
Okay. All right.
Until at the end of the month, so woman to me and to claim now, it is carried to the next year. So Oben who said 2021 January claim is still outstanding for a particular facility. Oman for number of them. Until we do not have a cut-off payment, Ubiabeka said, Yatuya me up to June, Yatuya me up to July. So because Yatuya me up to June, it is expected say Ubiabeka say Yatuya me up to June.
Okay.
Pauka say Yatuya me up to June, Ubi or say, oh, me January claims grab me minji. So those are the spotted ones I can answer.
All right. My final two questions. One has to do with all that you have to endure. Now, what is a paying for so there is a high subscription to the National Health Insurance Scheme. What it is answer in some way, how do you feel seeing 7 months in Jamuka? Me say, with all that you have to endure,
right?
7 months I in Jamuka. Now, what is a year abandonment paying for National Health Insurance, because amount for subscribing and the number of subscriptions, how do you feel when you hear these things?
You see, Maminka Assembly when they are talking, say people are subscribing to the health insurance. In some jurisdiction, it may be true. Some time back, it was a prerequisite requirement for people who are going to SHS. Okay. Okay, pa.
Yeah.
So, if you don't have health insurance card, they will not admit you in the schools. Okay, pa.
Oh, as for that one, then I didn't hear about that one. That it was a prerequisite document?
Yes, it was a requirement for people who are entering SS.
Wow.
And who need be a So why would the number not increase? If you have people like this registering, multiply the number of students across the country going to SS and are required by a policy to have health insurance card. Why would the number of people subscribing to health insurance not increase?
Okay.
Let us not be deceived by some of these statements. This is one of the reasons that you can find the number increasing. Not necessarily people are so happy and interested and want to register. No, that is not the case. Let's get this. Somebody from SS going to SS, what is the motivating factor for him to at all costs go and get health insurance card before going to SS, if not a policy direction?
All right. My final question.
If not a policy direction, my
final question. Cash and carry is most start to say be a more and I can deduce to say it's already happening within the public sector space now. What does it mean for our healthcare delivery system?
That is a failure. That is a failure on the part of the government to ensure that this system is raising its heads. Very bad one. Simply because cash and carry, in the wisdom of former President Kufuor, he made an emphatic statement that our people are dying and we need to have a solid health system to me abua, and it is premised on this that the health insurance came in. Now, Ukaya, before the introduction of health insurance or before the election around that time, all political parties were propagating the establishment of health insurance. And fortunately, Kufuor won, and he had no option than to introduce health insurance in the country. Now, come to think of it, another government came into office and tried to embellish it in one way or the other. Now we have another government in office, and under that government, we are having a very serious challenge. It's a serious case. And you see, if you interview Ghanaians who hold health insurance card, they will tell you health insurance card, who they call hospital, who beti, how do you call it? Consultation. But niya kaninano, who beti yahuka. And that is a situation now you won't see. And say, Minia, say kasa for health insurance, it's a whole issue that we need to look at as an organization and overhaul the entire system to the extent, say, if you are holding health insurance card, now Ghana card stroke health insurance card, Uber to me, Anya, quality healthcare services at any of the hospitals are with the card Nebeko. That is where we are getting to. So we need a complete overhaul of the health insurance system.
All right. Mr. Toblu, you better answer the person or Jamie and Edin Kumo.
Misumida was the Sewafre.
Yo, Mr. Frank Toblu Richards, General Secretary, my Private Health Facilities Association of Ghana. You know, Edin Kumo open to the down situation with healthcare management. Our Marumu Ebana National Health Insurance Scheme. Yeah, pro-poor government policy to ensure say Emamenum Enananum Sikopimi Hospital. Na sikasem enkoye barrier emfa maye emaye nya yayaresa